My name is Ahmet Kilic, and I'm a cardiac surgeon at Johns Hopkins. I lead the surgical portion of the heart failure program in addition to performing all aspects of cardiac surgery. These past 2 years have been quite a bit of changes with the COVID pandemic, and this year's upcoming STS meeting is no exception. Originally, we had planned an in-person meeting in sunny Miami. However, with the latest surge, we've had to convert the in-person meeting to a virtual format. As a subspecialty lead for the cardiopulmonary failure portion of the program this year, we've been working hard to ensure that the content is not diminished in any way by this change in format. There will be a number of great videos, presentations, debates in this upcoming year's program, and it will give our community a way to continue to engage scientifically with one another. This year, I've had the privilege of moderating 2 exciting sessions related to thoracic transplantation. The first session is in the category of Ask the Experts, and I chose to concentrate on the ever-changing world of having more available heart and lung donors become available. As I'm sure many are aware, there's always been an imbalance between available donor hearts and those patients with need of a heart transplant. This session I entitled, O Donor, Where Art Thou? And it will have 3 international experts, Dr. Carmela Milana from Duke, Dr. Ash Shah from Vanderbilt, and Dr. David D'Alessandro from Massachusetts General Hospital. And I'll invite them on stage as we discuss the latest state of the art in heart transplantation donors. We'll touch base on how to make donors become more available, advancements in the management of hepatitis C donors, groundbreaking work with xenotransplantation, that is using genetically altered animals to serve as donor hearts for humans, the latest in ex vivo perfusion and heart transplantation, donation after circulatory death, and a novel method of procuring organs utilizing normothermic regional perfusion to minimize the ischemic insult during the process. The hope is that during this 45-minute session that the audience is informed in the most up-to-date ways of successfully getting our patients on the heart transplant list to a successful heart transplant. The second session is entitled New Frontiers in Transplantation, and will focus on the latest stressors in getting patients suffering from end-stage heart and lung failure to a transplantation. In this current environment, we have a number of unmet challenges in heart and lung transplantation, and as such, this session will touch on a breadth of topics. We'll discuss racial disparities in COVID mortality following heart transplantation. We've certainly known for some time that we have work to do in this arena, but the twist of COVID mortality post-transplantation may highlight issues such as access to care and treatment biases. There's a talk on novel ambulatory veno-venous ECMO that serves as bridge for patients suffering from lung failure. We'll also debate the emerging technique of normothermic regional perfusion for donation after circulatory death, a controversial way of ensuring that the ischemic insult during the procurement process is minimized. In this hour-long session, we hope to engage the audience and the speakers in discussing what the current challenges and barriers are in transplantation and what methods there are to overcome these current unmet needs.